Good morning, and thank you for joining us today on this quick tutorial on how to use the 211 Connecticut website and the free My 211 account. This is a tool to help connect patients to resources in the community that address basic and other needs that are often outside the medical or healthcare delivery system arena. So this brief walkthrough today will focus on the My 211 account tool and is not intended to provide an overview of 211 Connecticut and our services. If you need that more general training about 211 and how to navigate the full website, please go here to our website, 211ct.org, and you can click here on the Professionals tab at the top of the page. And from there, if you go ahead and click here on Outreach and Training, you'll be able to view all of our archived webinars and trainings. And there's some great trainings here, often 30 minutes long, that can give you a good overview of the 211 system at our website. Okay, so let's go ahead and dive in. The first step to using My 211 account is to register for an account if you haven't yet. So when you're here on the 211 homepage, again, that's 211ct.org, you would go ahead and you would click on Sign Up if you haven't done so yet. And so why would you want to register and use My 211 account? Using My 211 account allows 211ct.org website users to create customized, patient-specific lists of resources for individuals, kind of like personalized action plans or care plans that can be saved in the user's account for future reference and editing, and that can be shared directly with the patient or other members of the care team. And that they can be shared through email, text, a shareable link, or by printing a hard copy. So to register for an account, like I said, you'll click on that sign up link at the top of the page, and then all you have to do is provide us with an email address, a valid email address, and a password. So down here at the bottom, a password. So those are the only two required fields to create an account, but then optionally we do ask for some additional information about yourself if you'd like to share that. And this is also something you can help patients do too. So it's great for clients to have their own accounts as well. And providers and community health workers will often help clients create their own accounts and empower them to use the tool too. Okay, so once you've established a My 211 account, you're going to go ahead and log in. So I'm going to go ahead and log into my account now. And again, it's just a valid email and the password that you set up. Okay, and now I can see that this has changed to My 211 account, which means I have successfully logged into my account. So from here, we can go ahead and start searching the 211 Connecticut database for relevant community resources. So let's use a case example and pretend we're working with a patient who lives in Torrington. And maybe this woman is struggling to afford food. Maybe she's struggling to pay the utilities and other bills, and is also a relatively new widower struggling with grief. So what we can do is we can go ahead and we're going to use the keyword search here. There are other ways to search the website as well through the categories. And, you know, we review all of those in the more general training videos on the Outreach and Training page. But we'll go ahead and we'll use the keyword search. We're going to start searching for food resources for her. So if we start to type food, we'll see that we get a drop-down list of suggested search terms. You can go ahead and click on one of those, or you can put in your own term. Here we're going to look for food pantries for her because we know she's struggling to afford her groceries. And then we can go ahead, we can put in a town, a zip code, a county, or for specific patients, it's helpful to put in their actual physical address, because the way that the search results are returned is in order of proximity to that address. So we'll go ahead, we'll put in her address. Maybe she lives at 100 East Main Street and Torrington. and we'll click search. And we're going to get here a list of food pantries that serve somebody who lives at 100 East Main Street in Torrington. And we can see that there are 7 food pantries. Now, if we're working with someone who maybe has limited means of transportation or other particular needs, we might want to filter down our list of results. We can filter based on day of the week that the program is open. We can look for services that are open now. We can filter based on gender, age group, or by radius. So for folks that have limited means of transportation, this is a particularly helpful filter. We'll click Filter Results. And now we see that there are 2 food pantries within 1 mile of where our patient lives. And so we want to start to add these food pantries to a customized resource list for this particular patient. So what we're going to go ahead and do, and if you want, you can look at the details of any of the resources to make sure that they seem appropriate. And then we're going to go ahead and start to add them to a list. So right over here, it says Add to List. Now, if I had already established a list for her and I just was adding to it, I would select this particular patient's list from this drop down, but I haven't created a new list for her yet, so I can do that up here. So maybe, let's see, we'll call her Susan B. Anthony, right? So resources for Susan B. Anthony. I'm going to go ahead and create my list. And now this food pantry is added to that newly created list of resources for Susan. I can go back to my results. I might want to add this particular resource as well, Fish of Northwestern Connecticut. So I'll go ahead and add this one. Now you'll see that this newly created list shows up in my list of existing resource lists. Okay. All right, that we know that Susan is not just struggling to afford food. We know she's struggling to pay her electric bill. She's struggling with some grief. So we know that we actually probably need to search for some additional services. And maybe we want to search for multiple services at one time because she does have multiple other needs. So we could go ahead and we could click here on Search Multiple Services if we wanted. We could start to type in electric because we know that she needs help with her electric bill. We know that she's struggling with some grief due to the loss of a spouse. So maybe we want to search for a support group for her. If we start to type in support group, we can browse through the list of support groups we have. Let's see, we're looking for a bereavement support group. We could go ahead and put that in our search. Maybe we also want to make sure that Susan is connected with the local senior center because we know that they have a lot of social activities and they also offer a lot of support and programming. We could type in senior center and add the senior center to our list. We don't need the food pantries anymore because we already searched for those initially. Okay, we've got a list of 3 additional services for Susan we want to search for. So we can go ahead and click the search icon. Okay, and now we have an additional list of resources for Susan. So here's the local senior center for her. So it's less than half a mile from where she lives, which is great. Go ahead and take a look at the details, and we're going to add this to her list. Add to list. Okay, we're going to go back here. Let's see, we've also found here a program to help her with her utility bills, right? So the Connecticut Energy Assistance Program, SEEP, we want to add this one to her list. See if she can get some help with that electric bill. There's another site as well. Okay, and here are some support groups as well, which is what we were also hoping for her. So let's add this support group to her list. And it looks like here's an additional support group. Okay, so now we've added several resources to Susan's list. If we want to go ahead and view the list of resources we've created and share it, we can go up here to My 2-in-1 Account. If we click on that and we click on Resource Lists, we're going to go to the index of all of the lists that we've created. So I have 27 resource lists in my account. They're going to be defaulted to being sorted by date created. So the list that you've most recently created will be at the top, but you can switch that and search by name, for alpha order if you prefer. But here's the list we just created for Susan. It has 6 resources in it. We can go ahead and open it up. And we'll see here the 6 resources that we've added to her list. We've got a couple of food pantries, the senior center, the utility assistance program, and a couple of support groups. And then here there's this button to print or share the list. And so if we click on this, here's where we have several different options. So we can email this list to Susan or a family member of Susan's or someone else on the care team if we want. We can put in here her email address, right? And we could also put multiple email addresses. So if we wanted to, put a family member of hers on here as well, we could send it to them. If her daughter or her son was working with her, we could copy her primary care doctor on it. We could copy a community health worker on it. We could put ourselves on it. We can add as many email addresses to this distribution as we want. We can also add some notes to this email. So if we wanted to say, these are the resources we spoke about today. If you have difficulty accessing any of the programs, please contact me at, right, and you could put your information here. You could put further instructions. If you want email replies from this email to actually come to the email address that's on file with your My211 account, you can keep this checked. If you want it to just be kind of like a no reply so that folks don't have your direct email, you can uncheck it, and then it's just, they'll get the email and they'll get all their resources, but it'll come from a 211 CT no reply email instead of your personal email address. So you can send the resource list that way through email. You could send it through text message, right? So you could we could put in Susan's cell phone number here, and she would be texted a link to open up her resource list. We alternatively could grab a shareable link to the list, right? So we've just copied the link to the clipboard, and we could copy that link into another email or onto a document or onto an intranet or website. Or for folks that need a hard copy, we could also print out the list and hand our client a hard copy of the list as they're walking out the door, which is still a really good option for some folks that may not be using some of the technologies. Okay. So similar to how we just pulled together a personalized list of resources for our patient, Susan, based on her address and her individual needs, we can also quickly pull together topic-based lists of resources that we can share again and again of community, needs. So these are things that are commonly needed or asked for resources. So for example, we could create and save a list of all of the emergency food providers in Torrington, right? So we could create a new list, emergency food providers, Torrington. And then to this list, we could add all of the food pantries, soup kitchens, home delivered meals, senior cafes, etc., in Torrington, right? So that way, whenever someone that we're working with expresses a need for food, we have a link ready to go to share with them of all of those emergency food providers in Torrington. And the nice thing about using the electronic list is that you're always accessing the most current information. So unlike paper directories that become quickly outdated. Okay, so I think that just about wraps it up. Thanks again so much for watching. We hope that this has been a helpful overview of how to use My 211 account. And we hope that the tool is helpful in linking patients to programs that can address some of those social and economic and financial needs that really impact their health. So the housing instability, the food insecurity, the inconsistent utility service, the and underemployment, the lack of transportation, and so many other contributing factors. And as you begin to use this tool, My 211 account, please don't hesitate to send us your questions and your feedback as we're continuously trying to improve the tool and the website. We can always be reached at info@211ct.org. That's info@211ct.org. Thanks so much.